Hello, I'm Dr. Grace Couchman from Carolina Conceptions, and I just want to talk to you today about the hysterosalpingogram, or HSG test. The HSG is a standard feature of an infertility investigation. It's a very important piece of the investigation because it lets us know that the uterine cavity is a normal shape. It lets us know if the cavity has any fibroids or polyps, and it also tells us if the tubes are open. This is a little model looking at a uterine cavity, fallopian tubes, and basically what happens with the HSG is there's a small catheter that's passed through the vagina and cervix, and the dye is instilled into the upper part of the uterus. And it will indeed show us if there are any filling defects, such as this polyp or fibroid, and then we'll see the dye hopefully go out the tubes into the abdominal cavity. This is the typical tray that we use to set up for our HSGs. And I usually tell patients that I consider this a super duper pap smear because it really involves a lot of the elements that all women are familiar with from having their annual pap. Basically, the test will involve just inserting a small speculum. We'll wash off the cervix and vagina with some cotton balls and a little bit of soap. And then basically this again is just the skinny little spaghetti noodle catheter that goes into the uterine cavity, and we're just going to put the liquid radiographic dye in, and hopefully we'll see the cavity be normal and the tube spill out the dye. So this is the typical table that the HSG will be on. We just have women drape their legs over the stirrups, and this is the C-arm radiographic instrument that helps us take the pictures. So the HSG can be done in any radiology office, or it can be simply done in an office setting such as here at Carolina Conceptions. One of the advantages to having a fertility physician do it in an office setting is that we can show you the pictures immediately and describe a little bit better to you what is actually happening during your testing as well as the results on that same day. So these are images from a typical HSG film. This is the speculum, the catheter with the dye, the little balloon that keeps the dye within the uterus. But here we can start to see the triangular shape of the uterus, and the dye is already spilling into the tubes. On the second image, the dye is seen coming out the ends of the tubes. And on our final image, we've deflated the balloon, and you can see a nice triangular cavity. A lot of women will chat on the internet about discomfort with the HSG. The majority of patients, and I've been doing these for over 20 years, do terrific just with ibuprofen or Motrin. But if you think that you'll be particularly anxious or worried about the HSG, you can certainly ask your doctor to prescribe some Valium or a simple pain medication.